there and welcome to the clinic. So today I've had a little rummage through all my medical equipment to see what new devices we may have for further ASMR videos. So first up, I think you will like this one, and it will feature in a video very soon. But we have this little case here, and I bet you don't know what's inside. Something very beautiful, and something that's going to tell me what your colour vision status is like. You can hear a little bit of movement inside the case. Have a little listen. So the movement there is from these little coloured caps which are used to check your colour vision status. This is the Farnsworth D-15 colour vision test, and we'll be covering this very soon to help you relax and generate some ASMR. Okay. And furthermore, this is the recording sheet I'll be using when we conduct the Farnsworth test. I'll place all your details here. Your name, your age, the date, the star, and this is for determining proton, deuton or triton type colour defect. You can check the right eye, you can check the left eye, pop the responses here, and then join the dots depending on your selected answers. So that is the recording sheets for the Farnsworth D-15 test. Okay, next up we have this peak flow meter, which we shall use to measure how quickly you can blow air out of your lungs. So this is the peak flow meter. We have the mouthpiece here, so we can detach the mouthpiece, sterilise it, give it a nice clean. That's where the air will travel. And the force of the air, we'll move the little counter here to the specific value. This is the scale. Okay, units, litres per minute. Okay, so that is the peak flow meter. What's that? Excellent. I know you may have seen this before. I just want to show you the contact lens storage case here. I have the L there, so you know where your contact lens is going, that you know that it's going in the correct part. Just have a little listen to the sounds when we unscrew. Put the solution and contact lens in there. And we have the pot for your right eye contact lens. And then you can store them overnight, like so. That is your contact lens case. let's have a look what we have next on the list for you. Oh yes, have this little device here, commonly found in your GP consulting room, your general practitioner. This is the pulse oximeter. The little on switch here. Press here, place your finger between the teeth, very gently makes contact, and then this will tell us your blood oxygen saturation levels, your perfusion index, and your pulse rate in beats per minute. So this is the pulse oximeter. You can certainly use this in some further real person ASMR videos. Lovely. Okay, next up on the list, I know you've seen these many times, but we've managed to acquire a new one. Say hello to this new fixation stick with some new characters to focus on and to follow. So there is our first character. This is our little dog there with the balloons. It's very happy. Okay, so you could follow the balloons. You could follow the dog. And then on the reverse we have another character for you to meet. This is the little rabbit with his vegetables. Okay, can you see him there? A little rabbit with his vegetables. Keep the head still, please. And follow the rabbit. Okay, now focus on the broccoli. Just follow the broccoli. Lovely. And next up, if you could follow the banana, please. Follow the banana just with your eyes. I need to know if there's any double vision in any meridian there. Good. And we have a miniature vision chart here for you, reading from left to right. Have a little go at those rows of letters, please. Have a little go. Excellent. And we also have a size around N5, N6 print type. A block of N5/N6 print type there. See where you can read to. Okay. We also have the little cross, or the black spot. We could ask you to fixate on. You could fixate on the black spot or the cross. So that is the new fixation stick. Excellent. Okay, next up we have this little device here. I'm going to set it up for you. This is an eyelid retractor. So if you struggle to keep your eyes open when inserting or removing your contact lenses, just place this on the conjunctival surface and just part the lids, keeping them at a nice distance apart and providing you with an adequate area to place the contact lens safely onto the ocular surface there. So these are the eyelid retractors. Very handy device for those who struggle to keep their eyelids open. Okay, it can be used for contact lens insertion and removal. Lovely. Okay, next up, this is another device commonly found at your GP practice or your optometrists. We have the yellow waste disposal bin here. It's got some important information here. You can pop the details here if you like. So I'm just opening it up. Just opening it up, you can place your used minims inside this tub. Any needles, for example, which you may have used on your patients. Anything for safe disposal in the clinic. Okay. And we must destroy by incineration. So that is your bright yellow hazardous waste disposal bin. Okay. And very quickly, we also have a selection here of prosthetic eyes. Collection of prosthetic eyes there, and they can be designed to match the normal eye. You can see how specific they are: the conjunctiva, the iris surface, and the pupil sizes vary as well. So those are the prosthetic eyes there. Have some polycarbonate safety spectacles here if you're carrying out any hazardous work where there may be some flying particles in the clinic. Light protection at the front, not so much above and below, but you certainly have the frontal protection there with these polycarbonate safety spectacles. A little bit of side protection there. It's a little bit wider. There. And we may be able to use a little bit of heat and adjust the length to bend for an adequate fit behind the ears there. Extensions there for comfort on the nasal bridge. Lovely. We have some universal indicator strips here. We have a collection of little strips here which we can tear off and used to check the acidity or alkalinity of any given solution. So we could tear one of those off, place a little bit of solution just on the end of one of the strips, and we have our pH scale here. So we have our acidic area here going to neutral, and then we have our low to high strength alkalinity grading area here. So that's something we can use in the clinic if needed. And just the instructions there. Have a little look at the instructions. So those are our universal indicator paper strips. pH scale 1 to 14 now. Lovely. we have these UV shield protectors here. The beauty of these is they provide good UV light protection at the side due to their thickness. We have upper protection for those rays coming from the upper area. It's quite wide. Again, we can adjust the sides for a comfortable fit behind the ears. And the beauty of these is they can be used over your general wear glasses. So if you're wearing your walking about glasses, you're outside and it's a brighter day and you are a little bit photophobic, you have very good UV protection with these shield spectacles there. So excellent for going over the top of your lenses. If you're wearing your bifocals, you shall have a protection distance, and even looking down to read, you should have complete UV ultraviolet protection. Okay, I have two more things to show you. So if you suffer from visual stress, it may be that coloured overlays could help to reduce your symptoms of visual stress. These are the coloured overlays, and you could certainly try these with your patient. So we have a purple colour, orange, a couple of shades of blue there, like a rose coloured one there. We have yellow and a couple of shades of green there. You also have your print tracker here to keep you on the correct line, stop you moving into different lines. It will keep you on the line that you want to be. That's kind of a little marker there. Okay. So that may provide a little bit of relief if you have visual stress. Those are the coloured overlays there. Coloured overlays. Okay, and lastly, something that's very ubiquitous in your GP practice. We have a blood pressure monitor here, systolic and diastolic blood pressure readings here. The pulse. We simply pop the machine on. We connect here. Roll up your left sleeve all the way to the top. Place it on the upper arm there. Detach, wrap. Achieve a nice, comfortable, snug fit around the upper arm. And it's simply a case of pressing the button there and allowing it to inflate and tightening around the upper arm, and then we can read the systolic and diastolic blood pressure readings in millimetres of mercury. Millimetres of mercury there. Excellent. Okay, so that is all the medical devices I want to show you today. I'm sure you're going to be seeing a lot of them in further SRP ASMR videos. So I'll leave you to it. Sleep well and have a good day.